Bismillahirrahmanirrahim. Assalamu alaikum. So today we're going to talk about clinical stations in particular and how to navigate through them. If you've not seen my previous video, watch the interview series number 1, which talks about the interview in general detail. Today we're going to concentrate on clinical stations only. So, preparation for your clinical stations, you need to go through all of the emergencies in your particular field. For example, medical trainees will have to go through heart attacks, strokes, meningitis, cardiac arrest, different arrhythmias, and all the medical emergencies that you are called to. Surgical trainees will have to go through acute abdomen, aortic dissection, aneurysm rupture, intracranial hemorrhage, intracranial bleed, and all the emergencies that you are usually called to. Orthopedic trainees may have to go through open fractures, joint infections. Anesthetic trainees will have to go through airway emergencies, breathing emergencies, circulation emergencies, major hemorrhages, anaphylaxis. So basically, whatever your specialty is, you'll be expected to know all the clinical emergencies of that specialty in much detail, number 1. And number 2, the detail expected out of you will be for your level of training. So if you're an SHO, you'll not be expected to have a consultant level management plan. However, you'll be expected to have some sort of knowledge, and if you have a consultant level knowledge of that topic, you're not going to be negatively marked for the level of knowledge. However, you do not want to act up, you will have to call for help in that scenario. You need to know your subject matter and then go into the interview with that adequate preparation. Now, before the station starts, you will have some sort of scenario read out to you. If you get that tiny preparation time, even 30 seconds are too much, use the preparation time and run the scenario in your head. The scenario will give you indications. Let's say, I'm going to just take an anesthetic example. You're working in a DGH as a ST3 level registrar, and you're asked to come and assist in A&E for a 28-year-old who's come in with status epilepticus found outside a bar and is now GCS3. I'm here, I'm sitting down, I'm thinking bar, GCS3 in A&E, 28-year-old, most likely have been fitting, may have used drugs, may have meningitis, may have a trauma. I've got the differential diagnosis in my mind. I know specific point of history I'm going to focus on. I know specific points of examination I'm going to focus on. I know specific investigations I'm going to focus on. So in that 30 seconds, make a brief or outline how you're going to manage that case. And that is going to help you inside the room when you go through those doors and are sitting in front of the interview panel. Read the scenario appropriately. So for example, if you're in a DGH looking after a head injury, you may not have neurosurgical capabilities, so you may have to think about speaking to neurosurgeons in advance, whether or not you have out-of-hours CT scanning services available, and you may have to transfer this patient out in time for either a CT or a neurosurgical intervention. If you are in a teaching hospital, some teaching hospitals lack certain super specialties. For example, not all teaching hospitals will have PCI services available. Again, not all teaching hospitals will have neurosurgical services available. So think about that and manage adequately. Again, if you're in a DGH or a teaching hospital, think of what kind of colleagues you will have. Will you have an SHO? Will you have a registrar? Will you have a consultant resident at night time? And then you will have to manage that team appropriately. Something very important to mention about clinical stations is, even though it says it's a clinical station, but it's not just clinical station, it is clinical knowledge and clinical acumen, which is two different things altogether. Your clinical knowledge is how you can manage that disease, and your clinical acumen is how you're going to manage that situation particularly. So let's talk about clinical knowledge first. So we talked about knowledge already. Do not forget about history taking. So if there is paramedic crew with the patient, some friends who brought them in, unknown stranger who's been found by fire brigade, anything, you need to have some sort of history. Number 1. Do not forget examination, and do not forget ABCDE management. So airway, breathing, circulation management, always. Think about bedside investigations, so ECG, chest x-rays, which are portable here and can be done at the bedside, blood glucose monitoring, etc., etc. And also think about other investigations or advanced investigations. For if you're thinking MI, you need an ECG and troponin. If you're thinking permeabilis, you may need an echo, a CT, a D-dimer. If you're thinking a head injury, you will need a CT urgently. So think of other investigations that you will probably need. And then you will have to come up with a differential diagnosis which is appropriate to that situation, to that patient, and also covers other important common stuff. So if you've got someone with chest pain which highly points towards an aortic dissection, do not forget to mention an acute MI or a ruptured aneurysm, because they are very, very closely related pathologies which can be fatal, and you do not want to miss that diagnosis. So your list of differential diagnoses should include, number one, most likely pathology, but also other pathologies which might be fatal and closely related. The whole point of this situation is that you need to be seen as a clinician who can make decisions appropriately, number one, adequately, number two, and timely, number three. You may also be asked to prioritize tasks. So for example, when I've gone down to manage the patient who's got low GCS, I may then be asked to help with a kid who has lost their airway. So on the ABCDE letter, the airway kid will take priority, in which case I will have to communicate with other team members. I may have to communicate with an emergency medicine consultant. I may have to communicate with my own consultant, my juniors, to come and help me out in this scenario. A low GCS patient may be managed by the medical registrar sometimes, so I may have to communicate with them. So communication is also a very important aspect, and that is a part of the clinical acumen which you're going to come to next. The clinical acumen looks at how you're behaving, number one, safely, number two, competently, and number three, showing empathy to that situation. To operate safely, you'll have to communicate with the other members of team. You will have to call for help as and when needed. You will have to call for help from other team members. You may have to call for help from different team altogether. For example, a neurosurgical patient, I may have to ring neurosurgeons and ask for help or some advice. You may have to rely on other people, so there's not enough room in resus. You may have to ask the nurse coordinator in emergency department to make some room elsewhere, arrange some monitoring for you, arrange a defibrillator for you. You need to understand the hierarchy of the specialty you work in. So if I'm working in aesthetics, I know a consultant is available on the phone all the time. So a junior registrar speaks to a senior registrar, who then speaks to their consultant. An SHO will speak to a registrar, and stuff like that. You need to know what other consultants might be available. So you may want to ring a registrar who is busy somewhere else. Then you may want to ring your consultant who is not contactable on phone. And this is a stressful situation. You need help. You're not getting help. So what are you going to do next? Will you ring a consultant from a different specialty, let's say intensive care, which is a sister specialty, and the consultant will most likely have anesthetic competencies? Do you want to ring a consultant of an entirely different specialty? For example, emergency medicine consultant may be there willing to help out. Do you want to ring another consultant in your own specialty who is not on call? So things you need to think about is be more flexible. That is why a clinical station is very, very tricky, because they're not just looking at your clinical knowledge, and that's the misperception a lot of people and trainees have, that we are just being assessed for our clinical knowledge, and that's not the case. You are being assessed for everything that you will do in a stressful situation that ensures safety of the patient, safety of the organization, and safety of the other members of staff. And number two, proves your professional competencies. Other things they'll be looking at is your leadership skills, so your ability to recognize deficiencies, your ability to delegate tasks, your ability to communicate with other team members. And also keep in mind that you may have to contact other specialties. As said, you may have to speak to ICU for ICU transfers. You may have to speak to other hospitals for transfers between hospitals and specialties. You may have to think about definitive treatment. So aneurysm will have to go to vascular surgery. If it's thoracic aneurysm, it will have to go to thoracic surgery. So think about those logistics as well. If you're a medical professional and you're sending a patient out, think about, will they need airway or breathing support en route, and in which case you'll probably have to speak to anesthetics in your own hospital to have a look at the patient first. A lot of times people forget about documentation. Do not forget to mention documentation when you're in a leadership role. Always mention, have a scribe writing everything down, because it's very important that you keep all the times, because medical legally is very significant. Also think about documentations exceeding medical notes. So Do you need to do a incident report? Do you need to report an allergic reaction on the yellow card scheme? Do you need to report a malignant hypothermia crisis to the malignant hypothermia service, or do you need to refer them to a super specialty? So these are the kind of things you need to remember as well. And the last thing a lot of people forget about is empathy. So empathy towards the patient, empathy towards their friends, their relatives. Who is going to speak to the family? Designate a member of staff who can go and speak to family. Be able to break bad news. Just show how well you understand the whole process of breaking bad news. So these are a few things a lot of people do not focus on and seem to forget when they're appearing in a clinical station. It's not just clinical, it is the whole way you conduct yourself in your everyday job. Remember the technical skills, but also do not forget the non-technical skills that you need, and go forward. Hopefully you'll do very good in your clinical stations. I'll be coming back with more stations very soon. Stay tuned. If you're not subscribed already, please subscribe to the channel, give us a thumbs up, share us with your friends and family so other people can benefit from it. See you again later. All the best. Allah Hafiz.